Hi, everybody, and welcome back to this week's What's Up Wednesday. Today, we're meeting with Karen Melott, who's our Child Care Partnerships Coordinator in Mesa County. She's going to be going over all things ASQ, ASQ SEs, which are the screenings that measure developmental milestones, and their importance regarding that in the child care industry. So, hi, Karen, welcome, and thanks so much for being with us today.
Oh, thanks for having me.
Of course. So, to get us started here, just tell us a little bit about your current role here and how long you've been with ELB.
So my current role, I am the Mesa County Coordinator. And so in Mesa County, we have 14 ELV sites. But when I was hired in September of 2019, I was hired as the Health and Safety Coordinator, which kind of left me working with sites and all across all 6 counties and making sure that they had ASQs completed, screenings completed, our vision, hearing, and dental. And so this was just ASQ SEs. And so this was just kind of what I was doing for the prior. And then in September of this year, I was hired as the Mesa County Coordinator.
Perfect. Yeah, you've been around for quite a while, kind of hopping around different roles.
Kind of hopping around.
So what are those ASQs and ASQ SEs that we're talking about today?
So ASQs and ASQ SEs. So an ASQ is an ages and stages questionnaire. So it's a screening tool that can be used by parents. Oftentimes we'll see it in the doctor's office, but it's a series of questions for children and for parents to fill out, or for a teacher to get just to kind of see where the child's at developmentally. So, and an ASQ SE, so very similar, same sort of thing. You're looking to see where the child's at, but this is more, the ASQ SE is more social emotional. So you're kind of trying to also see where they're at socially and emotionally in their development.
Perfect. Okay. So what are those 5 domains of the development in the ASQ?
So we're going to look at communication. We're going to look at personal social. We're going to look at gross motor, fine motor, and sorry, my mind went. Personal, and personal, yep, social emotional, let me see, social emotional, communication, gross motor, and Lord.
Yeah, I don't even know them off the top of my head to help you out. That's okay. Don't worry.
Fine motor. Sorry.
Oh, okay, gotcha. Good deal. Okay, perfect. So how are these screenings beneficial to children?
So it's actually beneficial to both children and families. So the beneficial part is for a family, it's giving you and that child kind of information, knowing where that child's at.
Okay.
So knowing where he's at developmentally, it asks a series of questions. It puts you in a position where you can see, is there areas that they are not to work with? Are there areas of concern? All these different areas can ASQ or an ASQ SE can give you a better feel of where kids are at.
Okay, perfect. So kind of how often do these screenings happen, and when do they happen in a child's life?
So they can start as young as 2 months.
Okay.
So they can start as young as 2 months. You can complete them every 2 months. So most programs try to complete them. So the best scenario I can give you is if you complete them every 2 months and there's no concerns, you can usually go to maybe completing them every 6 months, so twice a year. But if you complete one, so you complete one at 4 months, you feel like there's a couple areas of concern, you can always redo one at the age of 6 months to see if that's still an area of concern or if it's an area that they just kind of have gotten caught up in. So it just gives you that opportunity to look at it that often. At the age of 24 months, it does switch. So then it's every 3 months. And then when you hit 36 months, it's actually just a yearly. It goes to yearly.
Okay. Good deal. So depending on the results of these screenings, why is this information helpful to know to families and children?
So screening a young child is so important, and it's such an effective way, an efficient way for to know and to check where they are at developmentally, to celebrate any milestones, and to know what to look for next. So it kind of gives you that steps of what's going to happen next, and to know if there's an area, like I said, that you want to, you see something, you can look at that concern and say, let's go back and identify what that concern is.
Okay, perfect. So yeah, you did mention the parents to begin with in the process. So why is it important that the parents are included in that screening process with the children?
So it's so important because we want parents to be involved. They're the one that knows the child the best. So if you don't, by including the parent, you're giving the parent the opportunity to tell you about their child. That's what we want to know. We want to know what their child does when they're at home. There may be things they do at home that they don't do when they go to preschool. And so the parent sees that and the parent can relate that. And so it's important that all along this route that you include the parent.
Okay, perfect. Is there anything that parents should know prior to having the ASQ done on their child?
So one of the things that I think sometimes scares parents is it is questions. So it's a question of, can my child do this? What happens if I mark they can't do this? And so it's just a matter of just relax. What this really is trying to do is it gives parents that opportunity to be the person who says, oh my gosh, they can do this. Or it also gives the parent an opportunity that if there are concerns that they've noted, it gives that parent the opportunity to express those concerns on that ASQ and ASQ SE.
Gotcha. So where can people go to learn more if they've got questions regarding ASQs and ASQ SEs with this topic?
So if parents have questions, and there's a whole training guide, sites, centers can go there. If you feel like it's something you might like to put in your program, brookspublishing.com has a whole load of information. You can join and they'll send you resources. You can look at, they even do, you can sign up to do ASQs online. So which means with our new virtual world,
right.
They actually send it home to the parent's email. They can complete it at home with them, with
Gotcha.
the child. So it's changed how that works. So you don't even actually need a paper copy anymore. So
perfect. Okay, yeah, that's a good resource to have in case people want more information on that. Okay, so just to wrap up here, we appreciate it, Karen. Feel free to share any kind of final thoughts or updates for our network watching today on this topic for us.
So I just feel like if everyone can understand, so an ASQ, of course, is always, and I just try to emphasize this, is a screening tool. And so it should be used as that. And I think it's important, like I said, for parents and for teachers and for everyone to remember that what we're looking for is to kind of give that child a heads up. So we want to see if there's concerns. We don't ever want to use it as something other than the tool that it's meant to be.
Sure.
Is assessing if there's concerns in those developmental milestones.
Got it. Okay. Thank you so much, Karen. We'd like to keep these short and sweet. We'll give you your day back, but we appreciate you being here and sharing the resource as always.
Have a good one, thank you, Milena.
Of course. We'll see you next week. Bye, buddy.
Okay.